Hello, wonderful day to all of you. Today we are here to discuss a very important topic, hypertension. Before we discuss hypertension, I would want to just let everyone know that hypertension is quite common in the world, and one out of every three people aged between 30 years and 70 years has hypertension worldwide. So that's a prevalence of 33%. So that means hypertension is very, very common in the world, and if you have hypertension, there's an opportunity for you to learn more about the disease. If you don't have hypertension, maybe you should check and make sure you don't have hypertension. And if you've checked, you should live a lifestyle that will prevent you from getting hypertension. All right, so let's delve right into the topic. What is hypertension? Hypertension is defined when any blood pressure check is seen to be 130 over 80. Other definitions put it at 140 over 90. Now, there are a number of things that can cause the blood pressure to go high, including stress, including medications, and a lot of other things. So, usually, having just one pressure check of 140/90 or 130/80 does not necessarily mean you have hypertension. It will be repeated multiple times, and then also the doctor or the health practitioner will advise that you come in a week or two to recheck the blood pressure. If you recheck your blood pressure and confirm that the blood pressure is consistently high, then we have to do something about it. Why is it important to lower your blood pressure when it goes high? It's important because for every 10 millimeter of mercury, or for every 10 increase in blood pressure, 10 from 130 to 140 to 150, there is an increased risk of having stroke, of having heart attack, and of having the complications of hypertension. Because of this, it makes it very important that as much as possible, we control the blood pressure to reduce the risk and danger that it can pose to you and to your family as a whole. All right, let's do a bit of technical details. There are three stages of hypertension. There is pre-hypertension, where it looks at blood pressure between 120 and 129. There is stage 1 hypertension, looks at blood pressure anywhere between 130 and 139. And then there is stage 2 hypertension. Now, stage 2 hypertension is any hypertension from 140 upward. I'm sure all of us know that when you check your blood pressure, it usually gives three numbers. The first two numbers are for the blood pressure, and the third number is for the pulse. Now, concerning the first two numbers for the blood pressure, what I just described is for the top number, or what doctors call the systolic blood pressure. Concerning the down number, or the diastolic blood pressure, if your blood pressure is seen to be 80, or in other words, 130 over 80, then we are moving into stage 1 hypertension. If your blood pressure is 140 over 90, then we are moving into stage 2 hypertension. If you check your blood pressure and you realize, or they inform you that your blood pressure is anything above or equal to 180 over 120, it is something we call hypertensive emergency or hypertensive urgency. The difference is if there are any signs of damage to your eyes, damage to your heart, damage to your kidneys, or damage to your brain, what we usually call stroke. Because of this, if at any point in time a friend of yours, a relative of yours, or someone you know recalls a blood pressure of 180 over 120 or higher, it would be really, really advisable to advise this person to quickly seek medical therapy in order to prevent the untoward side effects this high blood pressure can have on the individual. Now, something that most of us know about, causes of hypertension. There's a lot of history, details about what brings about hypertension. Some say it's related to salt, some say it's exercise. I'm here to tell you that it's a little of both. However, before we delve into that, 90% of hypertensive cases don't have any identifiable cause. Doctors refer to this as primary hypertension. Now, because there are no identified or identifiable causes, it becomes very difficult to prevent it from happening. Even though there are no identifiable causes, there are certain factors that increase the risk of having hypertension. I'll go through a few of them so that we can learn. Number one, a high salt diet or a high sodium diet. Sodium works to draw or pull in water into the blood. So this can increase the amount of pressure that is in the body and lead to increased risk of hypertension. Number two, obesity. Obesity or high levels of cholesterol can cause hardening of the vessels or arteries through which the blood flows. This can prevent them from expanding when the blood is flowing through it appropriately, leading to hypertension. There are a few other things that can cause hypertension. I won't go into too much detail, but I'll tell you about them. There's something we call OSA or obstructive sleep apnea. This is usually individuals who, when they sleep, snore a lot, either because the tongue is falling back or because the jaw is small. In such situations, there can be an increased blood pressure as a result of it over time. Other factors include stress, diabetes, certain herbal medications like licorice. Pregnancy can actually cause an increase in blood pressure. Alcohol use, cocaine use, a high salt diet, as I mentioned before, certain medications like combined oral contraceptive pills over time can give an increased risk of high blood pressure. And certain medications like NSAIDs. NSAIDs are medications like diclofenac, ibuprofen, also over time can cause an increase in blood pressure. The good news is that most of the causes of hypertension from drugs are reversible in the sense that if you stop these medications, the BP usually returns to normal. Do you remember I mentioned we had two types of hypertension, one being primary hypertension? I'm sure you do. The second is secondary hypertension. Secondary hypertension usually accounts for 10% of all the hypertensive cases. It is called secondary because it is as a result of something. A number of organs in the body can cause secondary hypertension. Number one, the adrenal gland. If there's a dysfunction, it can cause secondary hypertension. Number two, the kidneys. A dysfunction in the kidneys can cause secondary hypertension. These are the two main organs that account for the majority of secondary hypertensive cases. Now, how does hypertension present? If an individual has hypertension, what will the individual see or what will others see that will communicate that this individual has hypertension? Unfortunately, hypertension is very silent. On most occasions, it comes without any symptoms. This makes it very difficult to diagnose in individuals who do not go for regular checkups. Most of the time, doctors only pick hypertension when individuals present with other symptoms, presenting for headaches, presenting for chest pain, or just feeling generally unwell. So the most important thing is to check your blood pressure regularly so that you can pick any increase in blood pressure before it becomes dangerous. How do we check our blood pressure? Nowadays, blood pressure machines are readily available in pharmacies all around and in hospitals and clinics. You could even get a machine and buy it and bring it to the house. So let's assume I've gotten a blood pressure machine. How do I check my blood pressure? Step one, I make sure I sit straight with my feet planted firmly on the floor, with my back straight, and I make sure I relax for about 5 minutes. Now, with my arm at the level of the heart, the machine will also be at the same level. I tie the cuff up around this arm, my right arm. I check, I record. Then I tie it around my left arm. I check and I record. If any of these readings are above 120/80, then I will have to take note of it. If it's above 140/90, this is stage 2 hypertension. I will have to see my doctor about it. If it is above or equal to 180/120, then it qualifies as a hypertensive urgency or emergency. I need to see my doctor immediately. These are the methods we use to check our blood pressure. Don't check it once, check it twice, check it thrice, and find the average. Now, to conclude, if you realize that your blood pressure is between 120 and 130, which, as I mentioned before, is defined as pre-hypertension, what can you do? Number one, reduction of your salt intake. Research has identified that reducing your salt intake actually reduces your pressure by up to 5 or even 8 millimeters of mercury. Number two, control your diet. Reduce your fat intake. Increase intake of fruits and vegetables. This increases control of the hypertension and reduces the BP by a further up to 8 millimeters of mercury. Another thing you can do is increase the intake of potassium containing foods like banana, like coconuts. What else is there? Quite a number of potassium containing foods are available. They help to reduce the sodium levels over long terms. And then finally, drinking cocoa drinks has also been identified to help to reduce the blood pressure over prolonged periods, not by much, but by a little. If, however, your blood pressure is consistently above 140/90, I will advise that you see your medical professional so that we identify if there is a cause. If there is a cause, we treat the cause. However, if there is no cause, then we start you on appropriate medications. Thank you very much. This is Dr. Chumesi, and what I'll leave you with is eat healthy, exercise regularly, and stay. God bless you.